What's up, guys? We're going to talk about Achilles tendinopathy, meaning pain in your Achilles tendon. So we're going to talk about what it is and what are some of the risk factors. So stay tuned. So my name is Dr. Marco Lopez, co-founder of the Basketball Doctors, and our mission is to improve the way you move to improve your basketball experience for life. So what is Achilles tendinopathy? So Achilles tendinopathy, it usually happens in your late 20s, early 30s, 40s, 50s. It doesn't really happen in the first part of your phase of your life, like the first 10 to 20 years, because the Achilles tendon is the strongest tendon in the body, so it withstands a lot of the force. So Achilles tendinopathy, usually what's gonna happen is you're gonna have pain in your Achilles tendon, usually in the mid portion of your Achilles tendon. And then sometimes in the insertional part, meaning where it attaches into the calcaneus. But most of the time in the mid portion, because they've shown that's where you have the least amount of blood supply near that tendon. But what is Achilles tendinopathy? So Achilles tendinopathy, best way I describe it, it's failed healing without proper recovery. So in other words, it's degeneration of the tendon. So over time, if you're not improving that capacity of that tendon, it's just gonna get degenerative in nature and you're not allowing optimal time to recover or improve the strength of it. So some of the things you'll see is we see the Achilles tendon a little thicker. And the reason it's thicker is because when you have Achilles tendinopathy, you have disruption of these collagen fibers. So the fibers usually have to run, just straight vertical, then they'll start kind of going in different directions. And that increases the thickness and sometimes even the cross-sectional area. So you'll see your tendon a little thicker, which it seems like it's swollen, but it's actually thicker than the other one. Another thing that you also see is that the Achilles tendon itself in the mid portion is not as what they call vascular, meaning like we talked about, there's not great blood supply. So sometimes you see a nodule in there. Another thing that we see in Achilles tendinopathy is increased stiffness. So stiffness of the tendon is okay, but too much stiffness is not so great. And the reason we have that is because of this increased number of proteoglycans in that tendon from that repetitive overloading without proper recovery. So how are you at risk? Like, how can I get Achilles tendinopathy? You don't want to get it, but we're going to talk about, how you might get it. And the most important factor that goes into that is overtraining. What we've seen in the clinic with the athletes, they report an increased amount of activity or load in a couple weeks, a couple months, which eventually leads to Achilles tendinopathy. So normally Achilles tendinopathy, it doesn't just happen from a week. It's more of accumulation, like we mentioned, a lot of just wear and tear on the Achilles tendon. So normally what we've seen around like 60 to 80% of all athletes that come in is that they said, oh, I started a new plyometric training program. I started a new jumping program without properly loading. Or they started playing more basketball, especially after that COVID year where they didn't play as much. So that increases your risk for that Achilles tendinopathy. Another thing that increases your risk for Achilles tendinopathy is some things that you could work on strengthening wise. So decreased calf strength. A lot of people don't do the proper calf strengthening exercise that we need to be doing. Another thing is decreased hip strength and decreased quad and hamstring strength. And the reason that's a risk factor is because it changes your mechanics. So if it changes your mechanics, that's gonna increase abnormal loading on that Achilles tendon and put you at risk for that Achilles tendinopathy. So those are some of the risk factors for Achilles tendinopathy, and that's kind of like what Achilles tendinopathy is. So if you guys have any questions, feel free to DM us, send us a message, or check out our other videos regarding Achilles tendinopathy.